Hi, I'm Dr. Jeanette Fuller. I'm a clinical psychologist and I work in the Luton and Bedfordshire Memory Assessment Services.
Hi, my name's Jo. I'm an advanced clinical practitioner for the Bedfordshire Memory Assessment Service. So, if you're worried about your memory, in the first instance you would go and see your GP. At that GP appointment, they would undertake some physical health checks to make sure there's not a physical health cause for any decline in your memory. They may also just do a little cognitive assessment with you, and then they would refer you onto the Bedfordshire Memory Assessment Service.
There are lots of different healthcare professionals who work in the Memory Assessment Service. There are doctors, nurses, psychologists and occupational therapists. On the day of your assessment, you're most likely to see either a doctor, a nurse or a psychologist. Usually the assessments take around about an hour and a half. Sometimes they might be a bit shorter or a little bit longer.
So for your memory assessment appointment, you would need to come with a family member, carer or friend who knows you very well, because that will help provide collateral information that we will need at that assessment. You would also need to bring, if you wear hearing aids or glasses, you would need to bring them to your appointment as well, as you may need them as part of the assessment.
In the assessment, we will talk to both you and your family members to try and gain some information about your memory and other thinking skills, as well as your day-to-day functioning. What we're trying to do is to understand what might be causing the problems either you or your family have noticed. To do that, we are usually asking questions about your personal background, your medical history, any mental health difficulties you might be living with, and lots of other bits of information. So it's a bit like an interview. There may also be some questionnaires that we'll ask you and your family members to fill in. Sometimes we send these before the appointment, but sometimes we might ask you to fill them in on the day.
So for the majority of people, they will be seen in clinic at one of our sites across Bedfordshire and Luton. But for some people, they will require a home visit, so we will go to see them at home. And for patients in residential care, we will also go and see patients in care homes and residential homes.
On the day of the assessment, you'll probably be asked to do a short pen and paper task that tests different thinking skills, including your attention, your memory, your language and your visual skills. We call this a cognitive assessment. In some cases, we might ask you to do some more detailed cognitive testing. That involves meeting a psychologist, and we call that a neuropsychological assessment. These tests are just a little bit more detailed and they cover a little bit more broad skills for thinking. On the day of the neuropsychological assessment, we won't be able to give you any feedback there and then, but the psychologist will take those scores away and will interpret them considering things like your age and your background, and then they will feed these back to the rest of the memory service team and offer you a second appointment to talk these through.